Thanks for tuning in to our weekly show where we want to help you look and feel great. Today, you can see we're talking about 5 truths about lip injections. For those of you that don't know me, I'm Becky. I'm a registered nurse, a health coach, and I've actually been a cosmetic injector for over 10 years now, so I've certainly seen a lot. The reason why we wanted to talk about lip injections is, I think there's a lot of mistruths out there. Of course, you can Google anything and get disaster stories or, just not a lot of great information. One thing that I realized is that, especially Monday morning around here, that's when we get the phone calls where people call and they're like, I'm bruised, I'm swollen. And usually my question is, didn't they sign their consent form? Right on the consent form it says risks of bruising, swelling, blah, blah, blah. But I do have to ask you, for anybody that's tuning in, when was the last time you signed your name to something and you didn't actually read it? Give me a thumbs up. I think I've done it probably 5 times this week online where you click terms and conditions. So that's one thing that really makes me realize that, as a clinic, we need to do a better job of educating and not just relying on a consent form to do that education for us. The other thing that I experienced myself was about a month ago, I had my lips done, and it had actually been about 2 years, so I kind of forgot the process and what I was going to go through. So it was really good, and actually I took pictures along the way, and we're going to show those to you so you can see kind of the process that I went through and what is normal. So let's get on to the 5 truths about lip injections. Number 1 is size does matter. Okay, when it comes to lips, it's really, really super important that not only does the size of the lip match your face, we're going to actually show you some pictures and talk about those 5 proportions. So again, that 1 to 1.6 ratio and why that's so important for the lip. I get a lot of people that come in and it's kind of funny, they've got a tiny, skinny little lip and a tiny little head, and they bring in a picture, and I know all my nurse injectors can relate to this, but they bring in a picture of Megan Fox or one of those Kardashian brides, and they want their lips to look like them. And it's like, okay, you can't really do that. If you've got a skinny, tiny little lip, you kind of got to go with it, all right? We can make it a bit bigger, and we can do it very gradually. So when we talk about size and 5 proportion, I'm just going to show you a picture here behind our screen. We have a lovely model who has since had a little bit of work done to her chin, and I'm going to explain why that is. So when we talk about 5 proportions, we are going to use our calipers to show you some measurements. Actually, I can do it kind of even from the side angle, but the top lip should be a proportion of like 1 to 1.6 to the bottom. So I'll do this front facing in a minute here, but from Cupid's bow to the middle should be our 1, and then our 1.6, this is kind of hard when people are blown up, should actually be 1.6 on the bottom. But the important thing when we're looking at the profile picture of the lip, and this is one reason I love the Vector camera system. So we've been using this system since last summer, and it's fabulous because we can actually take straight on pictures, 45 degree, and angles and all of that, and the system creates a 3D image that we can actually manipulate and move around. So we actually have a tool now where we can show our patients what they look like from the profile, because a lot of people, unless you're taking tons of selfies, don't see themselves from that angle. So we get these gals that come in, they've had a lot of lip filler done around the mouth, and they want more. And, the downside of that is that if you keep putting more and more product in the lip, and it's actually pushing that lip out and it's extending it out, that's actually going to throw the whole face out of proportion. So I just wanted to point out on our lovely model, she actually has naturally beautiful lips. This picture, I believe, was taken last fall, and she hadn't had anything done to her lips. In the photo, though, it's very evident that her chin is actually recessed. So instead of putting product in her lip, we've actually done her chin. And I think if you look on our Instagram or our Facebook page in the last month, those pictures are there. But how we measure that is you should be able to take either a straight edge ruler, a pen, a piece of paper, anything. Actually, maybe I'll use a piece of paper to show it well. And the top lip, the bottom lip, and the chin should line up. So when we go like this, you can see with our lovely model, okay, top lip, bottom lip, chin is way recessed back. So if she was to come in and ask me for more product in her lip, can you see how that's going to throw her out even more of proportion? So instead, we actually want to bring the chin forward, which we can do with filler as well. So this is just a great example of somebody that naturally needs that pulled forward, but quite often we'll see this lip protrusion develop because of too much lip filler. So we'll go to our next slide, which shows the actual thigh measurement. And if we can make that a smidge bigger, good. All right, so here we go. This is another thing that's been posted on our Facebook wall, Instagram. It's also in our new beautification manuals, which are free for our clients. Just stop by and pick one up. But it talks about, again, the ratio between the lower lip and the upper lip. So again, it's a 1 to 1.68 ratio. Okay, and that's for Caucasian women. Actually, different ethnicities, it does change a little bit. Sometimes, for example, Asian gals, the top lip is a little bit smaller and the bottom lip is a little bit bigger, and that's very, very natural. African American, it's actually more like a 50-50, and that's very natural. So these measurements are really kind of for the Caucasian woman. The other thing that we look at is when we're measuring the distance between the eyes, that's what sort of gives us that lip width. So that should match, and a lot of times as we're aging, that's going away. I'm going to show you my pictures here in a couple minutes, but a lot of times what happens with the lip, as we get older, this part of the pillow area is probably one of the first areas to kind of cave in, and you'll see that on my picture. So that's a great place to enhance. And when we talk about techniques, I'll show you kind of how we do that. So there's definitely different things we can do with different products. So we'll show you that in a minute. So here is actually one of our models, and there's a beautiful set of lips that perfectly matches that thigh proportion. So it's all about creating proportion, proper shape, make sure it matches your face, and the right size, We do have a lot of our gals that come in, especially these gals that are, Middle Eastern, and they're beautiful. And they've got big set of hair and big, beautiful eyes, and their face can carry a bigger lip. It's very, very beautiful. But for our 55-year-old woman who's English and has a little tiny head, we need to keep things in proportion. So I can't stress that enough. Next thing we're going to talk about is side effects. So in a minute, I'm going to show you a picture of some bruising. I want to stress that the reason why I want to show you this is because it can happen. It doesn't always happen. I would say maybe 1 out of 10 to 15 clients might experience, some more severe bruising. My motto always with our patients is plan on having the side effects. Just plan on having them so that if it happens, it doesn't ruin your life, okay? Don't get your lips done 2 days before your best friend's wedding or family photos or whatever. Just give yourself, really that kind of 7 to 10 days so that if you had some bruising or swelling, it's not going to ruin your life, okay? So I can't stress that enough. We'll bring up our pictures of our bruising, and I think, are we doing Becky first? Okay, so Becky was one of our models, and this was really fun because she was actually a model for a videotape that we're making for YouTube, and I was injecting her, and of course I hit a blood vessel in here, and she got a lovely bruise immediately, so that kind of wrecked our after photos. But what I really wanted to show you is that this picture was taken 5 days after, and it's a little bit hard to see. There's still a little bit of bruising in here, but just to show you, that you can go sort of from one extreme to the other. The whole lip is very, very vascular, which means it's full of blood vessels. That's what gives it the color. So on one hand, that's why there's a high incidence of bruising in that area, because when you're poking in with a needle, every time you do that, you risk hitting a blood vessel. The benefit is that if you do have some trauma in that area, because it's so vascular, it does heal pretty rapidly. Okay, again, the first couple of days kind of might be the toughest. So again, bruising, it doesn't always happen. I'll show you my pictures here in a second. The other thing I want to talk about is when it comes to the swelling, actually maybe we will flip it over to my pictures, because my pictures you can really see some extensive swelling. Right, so the thing that I want to point out here is this picture and this picture, these were posted on Facebook and Instagram. This picture was taken before I had my lip injection done. This picture was taken about 20 minutes after we were done. So I threw on some powder and some lipstick, which you're not supposed to do, but I did. So it's kind of a trick because those are the pictures that we post. We always post the pictures right after they're done, and usually the lips look beautiful. And then something happens. You go home, and sometimes where the pokes were, the bruises appear. Now bruises usually don't appear, you know, kind of they evolve over the next 24 to 48 hours. And the other thing that can happen is the swelling can kick in. Now there's different reasons for swelling. Obviously when we do a needle poke, you know, we can hit and cause a bit of trauma. That can create some swelling. The product itself can create some swelling. And the other thing sometimes that can happen, there's certain products that kind of are a little more prone to almost like a histamine kind of reaction, where it's almost like the whole thing sort of swells up overnight, and you look a little bit like a blowfish for a day or so. So I always say what goes up must come down, and so the reason why, you know, I want to share this with you is just so that you're not stressed should it happen to you, okay? One thing that I want to point out, which I think is really funny, is these before pictures, I had noticed actually in the last probably 6 months to a year, whenever I saw myself on camera or in a picture, I actually thought that my teeth were somehow magically getting longer. You know that expression, long in the tooth? And the funny thing is, now that I've had my lips done, I actually realized my lip was shrinking, so my teeth were more exposed. And so, you know, you can see that even in this picture here. But this was a day afterwards, and so you can see I was quite swollen in here. It was a little bit tender. You know, I was at the lake for the weekend, so I didn't care, but I probably would have been very self-conscious had I had a social event or something to attend to. You know, I could certainly put makeup on and hide it a little bit, but it was definitely swollen. So, you know, again, it can happen. Not always, but it can. Alrighty. So, actually what I want to talk about is a few tips to decrease bruising. Okay, there are things that you can do. There are theories that if you apply a vitamin K ointment or an arnica ointment to the area that you're having injected, that's one way of kind of strengthening the capillaries so you're not as prone to bruising. Arnica taken orally is also another theory. You can get that at health food stores. I've also read that taking bromelain, which is pineapple enzyme, before and after injections can actually speed up and decrease bruising. So there's a few little things like that. We do know that people who take a lot of omega-3 vitamins, as well as vitamin E, St. John's wort, all of those ingredients actually can increase bruising, kind of thins out your blood a little bit. So if you can stop taking them 5 to 7 days prior to your injections, that's very helpful. People that take aspirin on a regular basis are definitely more prone to bruising. Now, if your physician has you on aspirin for a medical condition, then for sure we don't want you to go against his advice. If you're just taking it on your own though, it should be safe to stop. You know, if you're not sure, you can always check with Dr. Briggs here. The other thing that I've seen over the years is that these gals that go out, if you have a bottle of red wine the night before their injections, their blood's a little bit thinner, okay? So don't do that. Maybe avoid alcohol if you can for 24 hours prior. The other thing is, if you're prone to cold sores, then you definitely want to speak to our physician about getting an antiviral prescription that you can take, you know, the day of your procedure, and usually for a day, 24 to 48 hours following, and that helps minimize the effect of cold sores. So the next thing we're going to talk about is product choice, because that has a big impact on lips. So I'm going to kind of go through sort of the evolution of products that we've had in our clinic. You know, going back, well, 10, 12, 13 years ago, there was other product lines that we used to use that we kind of got away from. We brought in the Juvederm product line, I believe, about 7, 8 years ago. And the first product that we kind of had available to us to put in the lip was Juvederm Ultra Plus. Now, at the time we all thought it was great, and it is a great product for other areas in the face, but we have really moved away from putting this product in the lip. The reason why is the product is very hydrophilic, which means it draws a lot of water to itself. And what we've seen over the years is gals that get it, even if it's injected right into the lip, the product attracts so much water to the whole area. So if you ever see someone and they've had their lips done 3, 4, 5, 7 years ago, and they almost look kind of monkeyish or almost kind of swollen around the lip, sometimes people think that the product itself has migrated to the area, and that's not so much the problem, it's just that the product draws so much water. And the goofy thing is when you want it to break down and go away because there's a problem, that's when it doesn't. So it seems to last sometimes for years. Now, we can, in our clinic, go in around the lip and actually break that product down with an enzyme called hyaluronidase. It's the same enzyme that we use if we, run into trouble with, product in an area where we don't want it. We can actually break the product down immediately. So that's one solution for those people who are walking around with that funny look. Sometimes we'll take it out and then start all over with a newer product. So that leads us to our Juvederm Ultra, which it's been around for years. This is kind of a great, reliable product. It provides nice volume, not huge volume to the lip, but is a really great starting point for people if they just want a little bit of volume, okay? The next product that kind of came to us 3, 4 years ago, Volbella came out, and originally Juvederm launched this product for lip injections, and we were so excited we put it in absolutely everybody, and we realized within about 6 months that it didn't last as long. The selling feature is that it's such a soft, fine product. It is beautiful for little fine lines around the mouth or even above the lip for those barcode lines. But because it's so soft, it tends to break down a little bit quicker. So again, we don't use it necessarily if people want a lot of volume. Sometimes if people are afraid, and that's something that we hear. People are so scared, they don't want to look big mama lips. They don't want to look like the gals in Hollywood or Palm Springs. I've heard there's a lot of big lips walking around there. If people just want to start really conservatively, Volbella is a great place to start. Volift is another product that Juvederm came out with that provides quite a bit more volume than the Volbella, and it is beautiful on the lip. Now the only thing is that both Volbella and Volift have a new technology. It's like a binding agent in the product that is a little bit more prone to some swelling. It doesn't break down as well. So for any of our patients that have an autoimmune disorder, or they have any sort of inflammatory anything going on in their body, I know Dr. Briggs will steer us away from the byproduct technology. Otherwise they're great products. And then the newest kid on the block is our Emerville lip. So Emerville is made by a company, Wrestling, which has been around in Canada, I believe, for probably 20 years or so. And Emerville is their new premium product. So it gives, I love this product, it gives tons of volume. Beautiful. The downside is that it's quite dense, so you can feel it in the lip a little bit more. I find, again, from personal experience, I still have some lumps in there. As an injector, we really need to blend this product beautifully right after it's put in while you're numb. But I love it, absolutely love it. The products, all of them now, have lidocaine in them, and so that's a great a way of really sort of minimizing the discomfort. I know that pain is sometimes a fear when it comes to lip injections, so there's different things that we do, we apply. Is that a question that we have?
Yes, we have Natasha, who says a lot of women are concerned about the pain. Can you talk about the freezing agent in the filler?
Absolutely. So again, all the products have lidocaine right in it now, and that's just been the last probably 4 or 5 years. Prior to that, we actually used to do dental blocks. We would go inside and freeze the nerves and basically freeze the entire face, which it was really tricky to inject people when half their face was frozen because you really couldn't see what you were doing. So we do have the freezing in there now. The other thing that we'll do, especially for new clients that are concerned about discomfort, is we'll apply a topical numbing cream all the way around the lip, which is really beneficial. Another question?
Well, Jenna says, great job, Becky. You're such a natural.
Oh, thanks, Jenna.
And Catherine says, Becky is amazing.
Oh gosh. Oh, stop. Oh, stop.
And Carrie says that she doesn't find it painful.
Okay, awesome. Yeah, I found like when I had my lips done last time, Joanne did mine, and we had no freezing, just kind of poke. The needles, and I'm going to show them to you, are so tiny. They really, really are tiny, but people definitely have different perceptions when it comes to pain. So sometimes when you believe something is going to be really painful, it is. And sometimes if you're just kind of a little more relaxed, I know our team, all of our nurse injectors are absolutely lovely, and they do a good job of really sort of calming the patient. So I think that that's important. So I want to talk more about now the technique that we actually use to put the product in. Okay, so there's 3 different ways that we can do that. So if you don't like needles, close your eyes. This is what a syringe kind of looks like when it comes to us. It's a clear gel, and in the package comes a little needle that we put on. Okay, I'll show you here. Here's a sterile package. So that's what the product looks like when it comes to us. Okay. Now, one thing I want to comment on when it comes to, again, size. Another question?
Yes. Crystal says, do you have a price list per vial, and how many vials do you usually need?
Okay, so actually, we'll talk about that right now. That's a great question. So when you see this syringe, it looks like a ton of product. It's actually 1 milliliter, 1 mil, which is the same size as a pea. So imagine a little green pea, and now we need to split that product sort of top lip, bottom lip, right side, left side. Okay? So typically, most lips are going to require at least 1 syringe. And, for the gals that do want to build up to a bigger volume, as an injector, I prefer to do that gradually. Have them come in maybe every few weeks and sort of gradually add. We can, so maybe between 1 and 3 syringes. Now, in our clinic, we charge $6.50 per syringe. We will break them up and do little top-ups if we need to, which is a great way to maintain the lip. So you're not, it's kind of like you're filling up the gas tank before it goes empty. And a lot of our patients will do that once they get the shape that's nice. Every 4 to 6 months, just coming in and topping it up is a great way. So I hope that answers your question. So we'll get back to our syringe. So with that needle, so this is typically, how the manufacturer is designed for the product to be injected. So you probably can't see this, but there's different entry points that we can go into the lip. When we are working around the lip with a needle, we need to be careful. There's, a major artery that runs up through this area, and it splits and it branches into the top and the bottom portion of the lip, and that's what gives it the color. But that artery also provides the blood supply, so it's important that we don't put product in the artery. So there's certain entry points that are safer. There's certain techniques that make it safer. With a needle, the nice thing about a needle is you can be very, very precise, but obviously every time you poke, you risk hitting that blood vessel. So, that's what could increase bruising and swelling as well. So it's kind of a toss-up. Sometimes we'll transfer the product into a little tiny, this is a little insulin syringe, so you can see how little it is. You probably can't even see the needle, it's so small. So sometimes if we're just doing a little top-up, we can go in this way and top up those pillows or put a little bit of product down here. And there's different techniques with the needles. There's, injecting parallel to everything. There's injecting perpendicular. There's crisscross techniques to lift the cupid's bow, to provide a pout. There's injecting the philtrum, which will provide a little bit of a lift in here as well. So again, usually when we're doing all those techniques, we are using needles. The other technique that we do here as well is we will use a cannula. So anybody in the medical field knows that a cannula it kind of looks like a needle, but it's not. It's actually round on the end. So the benefit of that is there's little tiny holes at the end of it. can you see that? Should I take it out? Try and take it out? Okay. I don't know if you can zoom in on this. But the benefit of using a cannula is if these are your blood vessels in your lip, and we're using a needle. Every time we poke, we risk hitting a blood vessel, whether it's a vein or an artery, and causing some trauma. When we're using a cannula, which is the best way to show you this, the cannula, it kind of pushes those vessels out of the way. So it's a much, much safer technique. What we do is we actually make a little entry point out here with a needle, which again, you can bruise in that spot. Then we can feed this cannula sort of in through here. So again, much, much safer. Downside is it's sometimes difficult to be really precise with it. You know, patients that have tried one versus the other, everybody seems to have a different opinion. You know, some people find the cannula more comfortable, some people find the needle more comfortable. So it's just one of those things that sometimes we play with it to find out what the best technique is for you. So that kind of covers technique. Now, the other thing I want to do is I want to go back to maybe my photos. Let's bring up my photos, please, Sam. And something that I want to show you is that just those two, it can be that one, but really it's just these two that I really want to focus on.
Which one's top two?
Top two, yeah. So if we look at these pictures, again, I didn't realize how much my lip had caved in. And you know what? My 16-year-old son actually pointed it out when we were driving about 4 months ago. I couldn't believe it. He's like, Mom, what happened to your lip? Your lips caved in. And I thought, what the heck are you talking about? And then I really started to see it. So this whole area here was just basically tucked right in. The other thing that I want to show you is that when it comes to lips, it's not just the lip itself. It's really this whole area that sometimes, you know, can benefit from being treated. So if you look at the corners of my mouth, how downturned they were. I looked miserable, sad and miserable. And then you can see in the after picture how we can just give that a nice lift. So sometimes we'll do that at the same time that we're doing the lip. We'll just pop a little bit in the corner. Depending on how deep it is, sometimes we can do it just a little bit of product. Sometimes we need to use a full syringe to, you know, take away that downturn in there. So I wanted to point that out. The other thing is I talked about the barcode lines before, which sometimes can appear across here. Sometimes we'll use a neuromodulator in those wrinkles to relax the ability to pucker, because it's that puckering that's sometimes creating them. I call them barcode lines. We used to call them smoker lines, but they're not, you know, sometimes it's just women, closer we get to menopause and we start running out of estrogen, the more we're going to see a breakdown in the structure of our skin. So we do have a lot of clients that come in, they've never smoked a day in their life, and they've got all of those lines there. So sometimes we'll relax the muscle. Sometimes we can put a little bit of product in there as well. We would probably use something really thin, like Volbella, because you don't want to see it, just to blend that area. So how are we doing with questions? Are there any questions that have come up again?
No,
nothing? Okay.
The last one. You didn't really touch so much on price for crystal though.
Okay, so $6.50 per syringe, and that's going to vary. You want to plan on definitely one full syringe, depending on what kind of volume you want. You know, we always start with one, and again, your nurse injector would kind of communicate with you as to which product they're going to pick for you based on how much volume you want. Okay, so I hope that helped. So kind of in closing, you know, what we want to stress as a clinic is our objective is to do really nice, soft, natural work. You know, if that's what you're looking for, if you want a lip that's soft and it's proportionate and maybe gradual, then, you know, a clinic like ours would be great. If you're not from the area, I encourage you to check out before and after pictures on clinic sites to make sure that that's the kind of work that you want. We don't want patients walking around with deformed lips, you know, and that's our work. So, you know, we really, again, with these tools that we can show people, it's just that maybe better communication as to really, you know, our goal is to help people look their best. We don't want people to look odd or funny. So if you're interested, just all you gotta do is phone either clinic. Phone numbers are on the website, and you can just book in a consult. Come in and meet Dr. Briggs, meet one of the nurses, and we can go from there. I really encourage you to please share this video today if you know anybody that could benefit from lips. Maybe you have a girlfriend that kind of has gone over the edge and you want to bring her back. Please leave comments and when it comes out. And again, you can go to the website. Is there a question?
What if someone needs hydration in the lips and not volume?
Vaseline. Volbella actually does provide a more hydrated lip. So when it comes to hydration, I can assume that maybe you're talking about when our lips really start to crease and they just look dry. Volbella is actually a beautiful, beautiful product for that. It just makes it look quite moisturized. Again, might not last for more than 6 months, but beautiful product for giving that look, okay? Again, when it comes to Vaseline, I actually encourage Vaseline on the lips after they've been treated just because they become a little bit dehydrated when they're first done. So that definitely helps. Please go to our website, www.externalaffairs.ca. Sign up for our newsletter. I believe it's at the bottom. Our goal is to provide more and more video teaching, tutorials, things like that, and we'd like to get those out through our email newsletter. Next week we're going to be talking about a topic that's a little bit more serious. We're going to be talking about migraine headaches with Dr. Briggs. So Dr. Briggs was trained by the neurologist that works for Allergan, who is the maker of Botox, and treats a lot of patients here with migraine. So he's going to talk about really what a migraine is, what's the difference between a migraine and a regular headache, how the Botox migraine program works, and then also kind of alternative treatments, even supplements and nutrition and things like that. So we're really excited about having Dr. Briggs. Is there one more question, Sam?
There sure is, yeah. So Carrie is wondering, are the same lip injection products used to put under eyes if someone is looking to get rid of dark circles?
Awesome question. Again, when Volbella first came out, it was the product that was launched for the lip. Now, I had the privilege about 3 or 4 years ago of training with a plastic surgeon from Milan, who in Europe, they actually had the product already for 3 years before us. And it was from him that I actually learned that Volbella for under the eye is beautiful. He actually said it kind of replaced a lot of his surgical procedures, where he was trying to fix hollowing, with Volbella. And so the reason why it works so great underneath the eye is that because it doesn't draw too much water to the area, because that's always been a problem under here, is most of the products, you can make it look nice, and 2 weeks later the patient looks puffy because water is drawn to the area. Volbella has a much, much, much lower risk of doing that. The other thing that we've just started doing recently is using that cannula technique. So instead of poking needles into this area, which again has a lot of blood vessels, we can actually do a little poke kind of from the outside and feed that cannula in, and it's a heck of a lot safer, and we see a much, much lower risk of both swelling and bruising. So I hope that answers your question. As far as the amount goes, between 1 and possibly even 3 syringes, depending on how deep that hollowing is. If it's just minor, just a little bit will do the trick, but if it's definitely a little bit deeper, we need to build it up slowly. Great. So migraines next week. Thank you everyone for watching our show. We look forward to seeing you next week. Bye.